So to perform venipuncture, you're going to want to stabilize the vein approximately 1.5 to 2 inches below the insertion site. You're going to want to let the patient know that they need to remain still and that they're just going to feel a quick stick. And then you're going to insert the needle at a 10 to 30 degree angle into the skin with the bevel up. And then you're just going to advance the catheter slightly. And then you're going to want to continue to advance it all the way to the hub. And as you push the catheter in, you're going to want to stabilize the catheter, and you're going to want to pop your tourniquet at this point. Then at this point, you will want to re-stabilize the needle. You want to apply gentle, firm pressure about 1.25 inch above the insertion site. And then at this point, you can remove the stylet. And then you'll want to quickly remove your top and connect it to your catheter. Then at this point, you can put a temporary stabilization device on here. And then we'll want to aspirate and assess for blood return. And then we would insert this solution. I'm not going to insert it today because I do have coffee in here and I don't want to waste all this coffee, but normally you would then insert the fluids. Then at this point, you can remove your fluid syringe and place it in your sharps container. Now we're just going to apply our transparent tape. Now we can remove our piece of temporary tape. You can allow your needle to take a natural position, and then we're just going to tape it up here. Alright, and then at this point, you would attach your label, and it would have your name, the date, the time, your initials, and the gauge of the catheter needle that you used to insert. And then you would just tape this. You would stick this next to here. You would then at this point reposition your patient for safety. You would educate them on being careful not to dislodge their IV, and then also the signs and symptoms if they do dislodge their IV. And at this point, we can remove our gloves. And perform hand hygiene. And for your documentation, you'll just want to state the date, the time. You'll want to describe the location that you inserted your IV. You will want to describe the number of attempts that it took, how the patient tolerated it. You also want to state the presence of a saline lock or a flow rate, and the method of infusion if fluids are prescribed.